Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello and welcome again. We are back today, wrapping up our interesting discussion on neurotoxin with my aesthetic injector nurse, Meghan Morrissette. Who would have thought there was so much information about Botox that we decided to divide it in 3 separate episodes to talk about?
Thank you again for having me, and I really look forward to this last part of our talk on neurotoxin.
All right, well, let's get right into it. So in this 3rd episode, what I want to talk about with you is a couple of topics, but let's start with the age that patients should be starting to get Botox. When is actually a good time to start? We will also touch on the possible side effects of a Botox treatment, cost of Botox, how could we possibly make it more affordable for patients? But let's start with the topic of age. When do you recommend patients start receiving Botox? What age is too young for Botox? And do you think someone can be too old to get Botox?
I love this question, and it is one I actually hear a lot more commonly now around the industry. Before I answer this, I think it's really important to first consider the aging process and what kinds of changes we see with each decade. The 20s decade is that transition time from a more youthful, truly young look to early adulthood. A lot of patients that I see in this decade are still holding on to their quote unquote baby face look, right, that we see. They have great facial volume and fullness, and then they start to approach the 30s decade and they start to see gradual changes. Faces thin out a bit. There can be a slight downward shift in the fat pads. So I think there are 2 significant considerations for patients in their 20s who are looking to maintain their younger look and delay aging at the same time. For me, this is protection from the sun, which is a really important thing to talk about, as well as other environmental factors, and then preserving skin health. Damage from the sun during this time frame often does not show up until the 30s or even 40s decade. And by damage, I mean pigmentation, redness, enlarged pores, fine lines, and crepiness. So sun protection is imperative and really cannot be emphasized enough. So going back to the skin health and ways to maintain this with more modified types of treatments, you can use small amounts of Botox that are placed more superficially in the skin, maybe tiny amounts of filler to better improve facial balance, and great medical grade skincare. But let's also keep in mind that some people in their 20s have very dynamic faces and very strong facial muscles, even though they're young. And they may actually require an adequate amount of Botox that I would give someone that's older. So aesthetic treatments, in my opinion, have to be customized to each individual's needs, but it's also important not to overdo things, especially at this early stage.
Well, thank you very much for pointing out the sun damage, because when you're young and healthy, you really want to party up at the beach and soak up the sun and play volleyball or do other things. And we live in Southern California, and I believe that we do see more sun damage in our clients. And when you're 20 and 30, you don't really think about it, but it does creep up on you and it will come back to haunt you. And it probably cost you in terms of, Botox, skincare, lasers, and so on and so forth. But when you explain it like this, it does make sense to consider starting some aesthetic procedures much earlier than people think. Usually people are very judgmental about aesthetics, and sometimes are like, what, you're 20, you're getting this and this done? But clearly, if you gently relax some of the facial muscles, the younger patients most likely will not develop as many deeper lines that will actually turn into becoming static and permanent.
Yes, that's exactly true. But they have to wear sunscreen no matter what. That's the most important thing when you're in the 20s decade of life, I believe.
Yep, that's probably correct. And I got to be honest with you, I still don't wear sunscreen as of today. It's probably just the way I was raised and educated, where it's like, oh, the sun is good and you have to soak up the sun. But that generation is gone and we're suffering now from a lot of sun damage issues. And if you're young or you know someone young, your daughter, listen to this and make sure that they wear sunscreen. Now, I remember a while back, probably almost 2 decades ago, when my sister told me she got Botox. Now, she is 2 years younger than I am, and I believe I was in my early 40s at the time, where maybe even late 30s. So when she told me this, that she got Botox, I thought, oh my God, you're not even 40. What are you doing getting Botox? Again, according to what we're discussing today, she clearly was light years ahead of me because that was 2 decades ago. Very interested in aesthetic procedures. She was fascinated by Botox and she actually became an injector herself. But again, it started with her getting Botox and not even being 40.
Yeah, I think the aesthetics industry now attracts more and more young people every year. This is due to many factors, I think, the biggest one being social media. Of course, our Gen Z generation is a lot more hyper aware of their appearance, their skincare, and anti-aging in general. I see many 20-something-year-olds in practice now wanting to start Botox because, let's face it, they are afraid to age like their parents and they want to get ahead of things. They want to start early. They don't want to have the wrinkles that their mom has and they can visualize them now. But I do see this, honestly, as a positive thing because starting some things early, like consistent medical grade skincare, small amounts of Botox, and maybe microneedling sessions will help delay aging a bit and prevent permanent lines from happening, as well as they're going to maintain their skin texture and they're going to control their pore size by starting these treatments earlier.
Great. Thank you for that. So now that we have determined starting some mild lasers, aesthetic treatments, skincare, and Botox in your 20s is actually a good thing and something that you recommend. Now, what are your thoughts on older clients, let's say over the age of 60 or 70, getting Botox treatments?
My answer to this question is highly dependent upon the specifics of that patient. It depends on what kind of procedures that they've done, whether it's surgical or non-surgical. What's their skin quality like? How much laxity do they have? One thing I also look at in particular is their brow position and how much upper eyelid skin they have. It's important to understand that if a patient has a really heavy brow and a lot of extra eyelid skin, they've never had a blepharoplasty or a brow lift, and now they're in for a Botox treatment, relaxing any part of their forehead and some of their orbicularis muscle around the eye can actually make them look and feel worse. And this is so important to point out to them and have this conversation. Botox cannot lift sagging skin in these areas. So I'm always really careful with patients who are more advanced in age, and I'm particular about who I treat, and I want to make sure they're a good candidate for this kind of treatment. I also think it's really important for patients that have invested time and money into facelifts and facial plastic surgery that they also maintain their results after with some Botox treatments, some small amounts of filler, and definitely laser treatments for sure.
Well, great. It sounds like Botox is also appropriate for the older clientele. But ultimately, it really depends on skin quality, how well they've taken care of themselves over the years, and as far as what results they can expect to see from Botox alone. Now, I still believe when you're after 70, a good fractional laser will trump Botox, but that's just me.
Right. And I would agree with you to an extent. The fractional laser treatments can give you great results. And then, they might need less Botox, or maybe they don't think they need it at all, possibly. I would never put an age limit on certain treatments. It's more really based on individual assessment. No matter what your age, you want to find a professional who will customize a treatment plan for you based on your skin type, your face shape, and it's never too early to start with the sun protection.
Great. So now let's get into what are the possible side effects or the adverse things that can occur after getting treated with Botox. Now, in a previous episode, we covered how safe Botox is, how many applications it can have in medicine. This is the first episode in this series. So if you haven't listened to it, please go back. We do talk about the indications. But I think it's only fair to say that if and when something does go wrong from Botox, it really isn't the product itself that is to blame. Is it perhaps the injector or maybe poor patient selection, or there are other factors at play? What would you think about this, Meghan?
Yes, I would agree. Typically, adverse events after a Botox treatment is a lot of the time injector dependent. It could also be that the patient wasn't a good candidate for Botox, or maybe the patient was not compliant and they didn't listen to any of the aftercare instructions that you advised them on.
Well, great. And we'll talk about all that. But can you start by telling our listeners about some of the possible side effects you have witnessed and maybe help our listeners understand how they can be avoided?
Sure. So I'm going to start with some of the more frequently encountered side effects before we move into more serious consequences of neurotoxin treatments. Of course, whenever you're injecting someone with a needle, there's a risk for bruising and even some mild swelling in the area. For me, bruising is not a common occurrence with Botox. It's more so with filler, but I do sometimes bruise a patient when I'm doing their crow's feet. The skin around the eye is really delicate and has a lot of vessels, and so you can get a bruise in that area. It's not crazy for that to happen. Bruising from Botox is usually always very minimal, and it will resolve in a couple of days. Another minimal side effect from Botox can be an initial headache, and that can happen sometimes right away after you're injected or 7 days after injection, but it only should last for a few days. And patients sometimes will get this headache because as the forehead muscles that were treated start to relax, the surrounding muscles around them may temporarily overcompensate, resulting in tension or discomfort. So let's get into some of the more serious side effects that can happen, mainly being the unintended spread of the toxin itself. This is a big one and can have pretty significant aesthetic impact when it happens. When I perform Botox injections on my patients, each injection is very precise. Remember, some muscles are depressors while others are elevators, and we treat those very carefully and strategically in aesthetics. Unintended spread can happen when Botox that was intended for one muscle ends up spreading into a nearby muscle that it was not intended for.
I love how you explain this whole thing with depressor muscles and elevator muscles, because a lot of people don't know and don't understand that an injector has to know in detail the anatomy of the face and all the muscles and where the blood vessels are and the nerves and everything. And most injectors should really take cadaver classes to understand the anatomy. And maybe you can give us some examples on how this unintended spread can happen. And so patients can kind of visualize a little bit what you mean by that.
Sure, yeah. Here are a couple examples of what I mean. So Botox can spread from the intended corrugator muscle that pulls down the eyebrows into a muscle called the levator muscle, which is actually right underneath it. And this muscle is responsible for keeping your eyelid open. So this is essentially an eyelid ptosis when this happens, and it can be catastrophic for a patient.
When we say ptosis of the eyelid, it means that suddenly the eyelid is so heavy, that muscle is too weak now from the Botox that you cannot lift your eyelid. So obviously that is indeed a catastrophic consequence. It's a terrible consequence. Those are very rare, but not impossible. And clearly it's something that it's a risk. Now, we're not telling you this to be afraid of Botox, but just to make sure that you understand that there are some consequences that can happen that could be pretty serious. Let's give us another example, please.
Okay, so there's another muscle that can sometimes get hit in the lower face when we are treating the DAO muscle, which stands for depressor anguli oris. This is the muscle that pulls down on the corner of your mouth. There is another muscle adjacent to it called the DLI muscle, depressor labii inferioris, which can actually get hit sometimes when you're treating the DAO muscle. And this can cause a lip lag or a lip ptosis. And when the patient smiles, they can have a crooked smile, which is not a good look either. So all of these things are adverse events that sometimes can be corrected. Sometimes the patient might have to wait out the length of the treatment before it gets better.
So if something like this happens, and obviously it's only on one side, can you correct it by doing the same on the other side so at least the patient is even? Or when you say it will be corrected, do you want to give us an example or tell us a little bit more about that?
Yeah, that's a great question too. So when it comes to a true eyelid ptosis, you won't want to give the patient eyelid ptosis on the other side as well to make them more even. So there are
Yes,
some
indeed.
treatments that we can do. So in our practice, we have Upneek, which is a special eye drop that forces your eye to open. And if I was to ever have an eyelid ptosis patient, I would definitely put them on Upneek drops. You can also inject the eyelash line where your lashes are. That can actually help if you do a couple units of Botox along the lash line. That can help force the eye open as well. So that combination can help an eyelid ptosis. When it comes down to the lower lip and you have a crooked smile on one side, you can actually go back and inject the other side with 1 unit of Botox to make them more even and solve that problem that way.
Great. Thank you. So that's very useful. And obviously, have faith in your injector. It doesn't necessarily mean you have to go change injectors right away if this happens. But occasionally, things like this do happen. It's very unfortunate. And again, if your injector is very, very, very careful, it's not likely to happen. But if it does happen, there are things that we can do to treat them, right? Again, this sounds very scary. Nobody wants that. But let's talk about the unintended spread. Because sometimes, yes, you put the Botox in the wrong place, you hit the wrong muscle, you don't want to do that. Talk more about the unintended spread. Like you spread the Botox, you injected in one place, you really want it to stay in that place, in that muscle, you don't want it to spread, clearly. Does the dilution of the Botox matter? Because everybody should know that the Botox come in the form of a lyophilized powder that needs to be diluted. So does the dilution matter, and would it spread more if it's more diluted?
Yes, absolutely. So there are a couple of things that we should talk about when it comes to spread. I do believe that the way the Botox is diluted or mixed is really important, and it will directly affect the spread. So when I mix Botox now, I use a 1-to-1 dilution, meaning that the product is very concentrated and it's only mixed with 1 ml of bacteriostatic normal saline. There are other injectors out there mixing with like a 2-to-1 dilution, a 3-to-1 dilution, even a 4-to-1 dilution are things I've seen and heard. And you can imagine that product is going to spread a lot, right? So a tight reconstitution like the one that I use has reduced negative side effects like the ones we were just talking about considerably for me. And it ensures that the product stays exactly where I intend it to be. Other ways to prevent unintended spread for patients is that they understand and they follow aftercare protocols. So I don't want them lying flat for 4 hours after getting injected or bending over. There's absolutely no facials for 7 to 10 days after treatment, because as you can imagine, an esthetician rubbing your muscles a few days after you getting Botox treatment can definitely potentiate problems and promote spread. I also instruct my patients not to rub their own faces at home and to treat their skin really gently for a few days as to not move anything around. So both good technique and patient adherence can prevent this kind of thing from happening.
Well, it's very interesting that people should know that the water that's used to dilute Botox, it's saline, which is basically water with salt. And water carries and spreads once injected into the tissues, and it will take the Botox with it. So the more water is injected, the more likely it is for Botox to spread if the dilution is a 2-to-1, a 3-to-1, or a 4-to-1, like you said, right? So I think this is important for our listeners to know. It's very informative. Thank you for mentioning that, because the way the Botox is mixed can clearly impact the spread of the product. Again, very useful information. Thank you for saying that. Now, if it was me getting Botox, I would likely encourage people to start asking their injectors, hey, what dilution are you using? But anyway, are there any other significant side effects you can perhaps share or talk about?
Yes. Another thing that can happen that has been in discussion more recently is related to more lower face Botox treatments, including the neck area. Especially now with the newer FDA indication for Botox in the neck bands, there's a lot more providers out there treating this area. And with that, of course, you're going to have a higher number of adverse events reported. So the platysma muscle, which is a large sheath muscle that covers almost the entire neck and comes up above the jawline with small little fibers, is this neck area that we treat with Botox. And it's a really large muscle, and it often is very strong on certain patients that can really pull down on the lower third of their face, leading to increased jowling, increased neck laxity, etc. So while I love treating this area on patients and I think the results can be really outstanding, you have to be careful here. I tend to treat the top part of the neck bands that are the strongest, and then I will do a little bit along the jawline, but I do not go crazy with the amount of Botox I inject in this area. And here's why. If you over-relax the platysma muscle, this can give the patient some serious problems such as difficulty swallowing, breathing issues, and neck mobility in general. So as this can be a serious issue, it's still completely possible to have a great result here while at the same time staying conservative.
Well, it sounds like in this case, less can be more, meaning you inject less, but you can get a better result and better outcome. So this is all excellent. It sounds like patient selection is huge. Technique dilution and staying within parameters for safety reasons. All of these will lead to great outcomes for the patient. So we should be able to avoid any kind of side effects that we have talked about. Now, let me switch gears and let's talk a little bit about the wholesale cost of Botox, what patients can expect to pay for treatments. Medical practitioners typically buy Botox wholesale from Allergan, who makes the maker of Botox. Today's cost is about $650 for a vial of 100 units. And then what's interesting is that medical spas or physicians can determine their pricing structure. They base it on the area they're in, how much the competition around them is charging, how comfortable they are with it. Are they unique master aesthetic injectors that have a really very good hand? And of course, those are going to charge more. And in some areas of Southern California, I think that the costs can range anywhere from $12 to even $22 per unit, especially in like higher end San Francisco, Los Angeles, with Beverly Hills being on the higher end of the scale. So, Meghan, in your opinion, if a practice is charging less than what we typically see in a given territory, would that be normal? And should a patient consider that maybe a red flag?
Well, to me, I would say yes, that probably is a red flag. The cost of buying Botox from Allergan is highly expensive, and buying it from other countries or trying to get it cheaper is frowned upon. And that's even enforceable by law, that if you're buying Botox from another country and then selling it, you're not supposed to do that. So it's dangerous. It could have other things mixed into it that you're not aware of. There are injectors who get their Botox from Canadian sources, and this is just one example of non-branded US-made Botox. So now as Botox has become more and more accessible, so too has counterfeit Botox that can be readily found on the internet. And this fake Botox can be deceiving because the bottles, they look just like the real thing. Some of these bottles could even contain no botulism toxin at all, or they could have more than the recommended dose. Federal agencies have actually identified more than 2,000 instances of counterfeit Botox being sold by medical professionals. And that's a really scary thing.
Man, that is a real scary thing. So as a client that wants to get Botox, how could you possibly know that your provider or your practice is using real Botox from Allergan?
Well, first, I would pay attention to the cost. Most patients are pretty aware of the cost of Botox in their area. So if you see an advertisement for a really low price, that should be a red flag. You can also go on the Allergan provider website and see if your injector's office is listed on there as well. And if they buy their product from Allergan, then they would be listed. I would even encourage patients to ask the person that's injecting them. It could be a very simple question like, hey, where do you buy your Botox vials from?
Well, if somebody's doing something onerous, they'll probably just say from Allergan. But I think that the price itself is a red flag, because if you think about the fact that the Botox vial costs almost $7 per unit to buy, someone that's injecting at $10 or closer to $11. This is a really low pricing. So if you think about all the overhead and the time of the injector and the risk that the injector takes, it doesn't make sense for someone to inject that cheap. Now, on the other hand, there could be practices like ours where we have a membership and people pay already a pretty hefty fee for the beauty membership. Now they get a special discount on Botox because we see them for all kinds of things, including skincare needs and lasers. And then in that case, I think you should really have complete faith that we personally here at the practice, we only use Botox from Allergan and we do not skimp on quality. Right, Meghan?
Yeah, absolutely. There are some great options for Botox memberships out there that I've seen not just at our practice, but others. And I think certain memberships make it more palatable for patients to be able to afford their Botox treatments and to actually make a commitment to getting treated every 4 months and not waiting longer or putting it off because of the cost. So the memberships are great. And then, to promote the fact that Allergan really does do a good job of throughout the year doing a lot of great promotions, doing gift card sales on their website. There's a lot of flash sales that they do or specials. And so patients can really benefit from being treated with Botox from Allergan as well.
Do you want to talk a little bit about the points and the alley points? Maybe for someone that's never used Botox, they don't know exactly how this works. Just a few words.
Right. So the program that Allergan developed, it's like a patient savings program for Botox users. Every time you get treated in the practice that you go to, if they carry Allergan Botox, you get to issue them points, and those points accumulate. So over time, they'll save $50 on a treatment or $70 on a treatment. And so that can also be a great way for patients to save money each time they get injected.
All right. Well, thank you very much. I think overall, this is extremely valuable information for our listeners to consider before they decide to get injected. Obviously, just like any procedure, the demand is always going to drive up the price. And I believe the cost of Botox 10 or 20 years ago was a lot cheaper, and apparently it's likely projected to go even higher in the future. So if you consider the fact that on an average, a patient can get about 60 units 3 to 4 times a year, and every time they get injected, they're spending between $800 and $1,000. You can see how someone can end up spending quite a bit of money over injectables, not just yearly, but over the course of a decade. So as a conclusion, I do think that wrinkle prevention is a lot cheaper than waiting for dynamic wrinkles to become static wrinkles. So maybe there is value for the younger generation to consider spending some time and money in order to prevent wrinkles. So thank you again, Meghan, for sharing your opinions and your viewpoints on neurotoxin. You really have converted me to be a believer in the treatment and efficacy of Botox.
Yeah, and thank you, listener, for giving us the gift of your time and dedication in following the content of this episode. And I'm really looking forward to my next series with you, Dr. C, in talking about lasers and other aesthetic treatments.
Thank you, Meghan. We'll be sure to invite you back and talk a little bit more about beauty and things that you might not hear anywhere else. We welcome you back, and we, again, thank you very much for giving us your time, and we'll see you next week. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.